Fridays. I would just like to say that I will be at the Capitol sharing your stories with our legislative representatives and our senators. If you have a chance to get on Safe Matters, please do. I have the QR code in my purse and I will give it to you at any time. We need the people in office to hear our stories. They need to know that this place isn't just full of pretty buildings. What goes on inside isn't as pretty as what these buildings look. I thank you all for being here, and I really congratulate you all for being so courageous in in your workplaces and what you're doing. And here we are. We also have Virginia Smith, a fellow board member, right here, sharing the love and sharing your stories. I would like to introduce Lori Curtis with this organization, and she's our MC for the night. Go nurses and go!
Wow, it's just exhilarating to be here. Welcome to the ONA Nurses Rally at Providence. How y'all doing tonight? I can't hear you. How y'all doing? Awesome, excellent. Again, my name's Lori Curtis. I am an ONA hospice nurse at Providence Home Health and Hospice, and I want to thank each and every one of you for coming out here tonight, giving us your time and supporting the frontline nurses, our patients, and our community's care. We would not do this without support from the AFLO, CIO, Teamsters, SEIU, and many others. Last Friday, our nurse colleagues represented by the OFNHP were at Kaiser Sunnyside, standing up to demand better staffing from their administration. And tonight we are here because we also demand safe staffing. If I were in healthcare administration, I would be wondering what the heck is going on with rallies going on every Friday. I would probably start asking some serious questions about that. We're tired of Providence's executives trying to put frontline nurses at the kids' table. While they tell us how to care for patients, we know how to do that. We're tired of them complaining that they are broke, making $4 billion in annual revenue. Mostly, we are tired of Providence execs listening to us but never hearing what we say. I've got one question for you. You answer yes or no. Do you think they hear us now? Yes! Let's try that one more time. Do you think they hear us now? Yes! That's right, they can. When we stand together as ONA nurses across 10 Providence facilities, we can raise standards at every Providence facility for everyone. This year, ONA nurses will have 7 open contracts. 7. That's a tremendous opportunity for us to stand together and demand that Providence foot the whole bill for our paid leave, improve staffing, and bring everyone's wages to market level. Our first speaker is Richard Botterill, a nurse in the emergency department at Providence, Portland. Richard has been instrumental in pulling nurses from all Providence facilities together. He knows that only by working together we can make change happen.
Hey everyone.
Hey.
Thanks for coming out this evening to support the rally to protect nurses. Thank you, not just the nurses that are here. I know there's a lot of community members. I know there's a lot of people like Jamie who comes out. This guy comes out to every single event, rally, picket, I don't care what it is. He's always out here. You know, huge. So here we are. We're here to support the nurses of Providence Seaside, Providence Home Health, and Providence Portland up the road. But it's bigger than that, because it's the way we show solidarity and unity with all of the other Providence hospitals throughout this state. And it's bigger than that, because right now we've got OHSU at the table. St. Charles down in Bend are at the table. Kaiser were out picketing a week ago today. So it's much bigger than just Providence. And it's much bigger than just those hospitals. It's also all of the hospitals that are spread across the state of Oregon, our state, right? All of them. And it's not just what's happening today, it's what's going to happen in the future, because we're laying the table. It's who comes after us. It's preparing the ground for the new students, the new nurses that are coming in. And it's bigger than that, because you look and we've all seen all the work that's been done in New York State. 12,000, 17,000 nurses on strike. Right? And it's bigger than that, because there's other states across this country where nurses are saying enough's enough. And it's bigger than that, because I have a sister and a cousin in England who are nurses. They're doing the same thing. When they went out on strike, there was 100,000 nurses went out on strike.
Yeah!
And it's still bigger than that, because now we're seeing the same things in France and in Germany. It's across the entire planet right now that nurses need to stand up, as we're doing this evening, and say enough's enough. And that's not right. It's just not right. And it's the same thing everywhere. It's inadequate staffing. It's poor healthcare benefits. Healthcare that's difficult to access and get into. Insurance companies that jerk you around. It's substandard hourly rates that don't even come close to keeping up with inflation. We're getting poorer every year at the moment. And it's bare minimum PTO and sick time and vacation. You know, there's a lot of different issues, but those same 4 issues, they cover pretty much every single hospital, whether it's this country or any other country. It's the same thing, and that's not right. As nurses, we've known this staffing shortage was coming. We were talking about this 6 years ago, but nothing was done about it. We didn't look at the total package. Providence, we said at that time, I remember talking with some of management and saying, hey, we've got to have a decent package so we can keep our nurses and so we can attract nurses. That didn't happen. And that is not right. There have been no attempts by Providence to care for our nurses the way we care for our community. We're the only system in the state that hasn't been providing any kind of retention. We haven't done it. And that's why we're losing people. And when we don't have a good package, we can't attract people. It's no wonder we have a staffing shortage. They're not standing up for us as we stand up for our community. And it's not just the nurses. I know we're all nurses tonight. It's not just nurses. It's all of the other people that make it work, that care for our community. And that's not right. This week we were at the table. We have given Providence management 25 plus proposals. 5 weeks ago, we gave them the last of our proposals. A couple of days ago, they came back and they responded to 5 of them. And that's not right either. So now it's time for Providence to stand up and back up their very public stance of saying they care for us and they care for their nurses. That is right. It's time for Providence to solve unsafe staffing, listen to the nurses when we say we need to have realistic and safe staffing. We need to be given the staffing care for the community that we have cared for the 3 years of the pandemic, and it ain't getting any better. We're still understaffed. We're still seeing lots of high acuity. We're still seeing lots of long wait times. It's time for Providence to stand up and take care of those issues. And that is right. It's time for Providence to provide health care benefits for the nurses that are comprehensive, they're easy to access, they're reasonably priced, and to provide decent vacation time and sick time. The nurses that stayed with Providence through the pandemic, the nurses that put themselves at risk, the nurses that put their families at risk. Nurses were going home and changing in their garage so that they could go in and not run the risk of carrying anything in to their families. It's time that this was addressed. We need to have a decent benefits package so we can keep nurses and we can attract nurses. Providence needs to stand up and show they mean it when they say they care about us, show that they mean it when they say they care about the community. And that is definitely right. And it's by standing together as nurses, not just us here at Providence, not just the community, not just the people that sit and provide nursing care throughout this state, throughout this country. We all need to stand together, because when we stand together in solidarity, in unity, then we have strength. Then we can go back to them and say, this is what you need to do. So thank you all. So Providence, step up and show us that you care. Thank you all for coming out today. It warms my heart. It's a great show. Thank you.
Thank you, Richard, for reminding us how important it is to stay with the fight and keep united. Next, I am proud to introduce a colleague of mine and talk about our shared struggles. Jamie Canales is a nurse and ONA member at Providence for the past 10 years. She has worked to help bargain units to get fair contracts, and now she's helping to work with bargaining this one. Let's hear it for Jamie.
So I'm a home health access nurse and Providence Home Health and Hospice's bargaining unit chair. Home Health and Hospice's contract expired last year along with Providence, Portland, and Seaside. We are aligned not only in timelines but in shared values and the expectation that our employer must agree to our demands.
Yeah.
Because we as nurses know what is needed to make Providence safe for patients. Providence is losing nurses because they are choosing profits over people. Nurses are the foundation of the healthcare profession. We need safe staffing language in our contracts that aligns with recent legislation and that is enforceable. Because otherwise, Providence will continue to find ways around it. We absolutely need competitive wages that will help us recruit and retain nurses. A healthcare plan that supports nurses and their families, and an appropriate amount of sick leave so nurses can work safe, not sick. Nurses thrive when we're able to provide excellent care, but we cannot provide that care when our employer refuses to commit to fair contracts. Recently, we filed a class action lawsuit against Providence for wage theft. Hundreds of employees across the system haven't been paid correctly for months. We need contract language that holds Providence accountable for paycheck errors. Morale is very low in home and community care. We are deeply saddened when we're not able to safely provide care for our patients. We simply do not have enough nurses. Hospice continues to increase the caseloads to unmanageable levels. Newly hired nurses and experienced nurses are quitting due to the burden of being part of an organization that is failing our communities. Home Health and Hospice has had persistent, unsafe staffing for years. Many patients are not getting the care they need. We cannot meet management's ridiculous productivity expectations. Providence nurses need time to care properly for patients and their families. Unless Providence agrees to our proposals about productivity and safe staffing, we will not be able to provide the care that we take pride in and that our patients deserve. Yes. We are here today to demonstrate our determination. Nurses are first and foremost patient advocates, and this right here is nurses advocating for patients. Thank you.
Yeah.
Thank you, Jamie. No nurse should have to track their productivity. We are not assembly lines, and we know how to take care of our patients. Now we have a familiar face for many of you. Virginia Smith is an ONA board member and executive committee president at Providence Willamette Falls Medical Center. On Tuesday, the Oregon legislature gavelled in for 2023 session, a session that is gearing up to be contentious. The top priority for us is a safe staffing legislation. Virginia Smith is here to explain what the legislation will do and why we must all work together to get this passed.
Hey.
Hi, everybody. I just want to say thank you for toughing it out here in the cold. And those of you who've dressed well enough, good on you. I just want to say hi to OFNHP. Thank you so much for being here. Jobs with Justice, Portland PSA. You guys are amazing. Thanks for being out here today. And thank you for that introduction, Judy. As you said, I'm an ONA board member. I'm the chair at Willamette Falls. I'm also one of the founding members of the Nurses Uniting Raising Standards Coalition for Providence Nurses. I'm super proud to be here with you guys here today. As nurses, we spend our careers coming to terms with the systemic problems with our healthcare system and within Providence. We do this every day when we stand at the bedside with our patients and try to give care. But there are times when, and this is one of them, when we do not have to settle for the status quo, when we can turn the tables and fix the systemic problems that healthcare and Providence throw at us every day. I know because I've seen it happen. I testified in Salem with the first staffing laws back in 2015, and we could do it again now. Many of us have spent the last 5 years working to bring ONA nurses at every Providence facility together because we knew when we stood united, we could make the changes that nurses and our patients need. And we were right. During the last contract cycle, Willamette Falls, St. Vincent, Milwaukee, and Hood River all stood together to win the best contracts in our history. And we're hoping to see the same for Providence and Portland Prov and Home Health and Seaside coming up soon. We raised pay, we protected healthcare benefits, and we laid the groundwork to improve staffing standards. Now, because of the unity and strength that we've built up, we have the chance to truly raise staffing standards for nurses and patients across Oregon by passing our Safe Staffing Bill this year. Our Safe Staffing Bill includes what nurses have been asking for ages: minimum safe staffing standards for all units, ensuring nurses get real rest and meal breaks, transparency so that everyone can see when hospitals are understaffing, the right to sue hospitals when hospitals understaff, and actual fines for every day that hospitals fail to meet safe staffing standards. Our Safe Staffing Bill will make generational change that will raise the bar and set a new standard for every Oregon nurse and patient. It will keep hospital execs accountable for their staffing decisions, and it will keep nurses in our profession by making sure every day isn't the worst day at work. No more worst days! We have already seen too many colleagues walk away from the bedside because they refused to continue sacrificing their health and their safety and the safety of their families for a system that's rigged against them. It is time to change and make nursing a sustainable profession again.
Yeah.
It is time for Providence and all other hospital execs to step up, to live to their mission and ease our way so that we can care for our patients and our communities.
Yeah.
If we pass this staffing bill, it will happen because we have proven that when frontline nurses stand together, hospital CEOs don't stand a chance. So today, I'm asking you to take a staffing flyer from the registration table. You guys saw it up there. It's got the QR code on it. Please scan that and sign up to support our safe staffing legislation so that we can make sure Providence and every hospital in Oregon staffs safely and takes care of frontline nurses so that we can take care of our patients in our communities. Thank you.
Yeah.
Thank you, Virginia. We want to remind you all that you all can go to that place involved and find updates in safestaffing.saveslives.com. All right. Okay.